Hi, it's Dr. Gemma. This is not a strategy as such. Uh, this is actually about things you should know if you are seeking psychotherapy, because I'm doing a sort of fast and easy one today, because as you can tell, I'm at work right now and I've got a bit of a break. So, first of all, I want to thank the latest coffee donors, who would include Linda, Terry, and Sarah. Thank you very much. I really appreciate it. Um, so, this one's for you. And so we're talking about what you need to know when you're looking to get psychotherapy and things that I wish people knew, all right? So the first thing here is that I'm talking about psychotherapy. I'm not talking about psychiatry. Psychiatry is practiced by a medical doctor. I'm not that. And those of us who provide psychotherapy typically aren't. So I'm talking about getting mental health treatment with someone like me, a psychologist. That is, I have a PhD. I have a PsyD actually, but it's a doctorate. Or somebody who is a licensed clinical counselor, a licensed marriage or family therapist, a licensed clinical social worker, or like me, a psychologist. And it's important that I'm talking about licensed people there, and I'll come back to that a little bit later. But the idea is, we're the professionals. We're supposed to be able to work with you on this stuff. We have different backgrounds and we have different areas of expertise. And that varies a lot state by state, what is required of each level. So I'm not going to talk as much about that as I would like to. What I want you to know is that, first of all, it's not like whatever you see on television. Yes, my glasses are now being a problem. That psychotherapy, it's not what you see on television. That's a lousy representation of us about 95% of the time. As you can see, I do not have a German accent. I do not think I'm Sigmund Freud. I actually don't believe very much from Sigmund Freud, although I will acknowledge some great contributions there. I'm pretty laid back. If you look at me, I'm not wearing a three-piece suit. I'm wearing business casual because I have to sit all day while I talk to people and I have to look approachable. Okay, so no, I'm not dressed to the nines. I'm dressed to be comfortable and to look like someone you can talk to. The other thing is we are not judgmental, and that's the biggest thing that keeps people out of therapy, is they're really waiting for someone like me to jump out of the chair and go, "What? You're a horrible person." We actually don't do that. I can't speak for every psychotherapist, but in my scale, I have worked with people in inpatient, locked inpatient, court-ordered. Right now I'm working in private practice therapy. Really, if you're watching this video, it's kind of unlikely that you're going to come in and tell me something worse than some of the things I have heard, okay? So no, it's not my job to judge you. Most of the time, my job is to be a consultant. And that leads to an important difference I do want to make plain here. There is a difference between a patient and a client in therapy, okay? So I'm a psychologist, I have a doctorate, I do differential diagnosis, I do testing and evaluation. And I know a little bit about the medication for mental health, although that really is largely in the hands of psychiatrists, MDs. I know just enough that I can basically point you to an MD if you say you're having a problem, or I can alert them if you're telling me that you're having a problem. But I don't prescribe, and I don't deal in quantity, like how many pills or what amount of pills you should be taking. I just know very, very general information. I'm just allowed to talk about it a little bit, okay? But the reason that's important is, as a psychologist, you may come into my office as either a patient or a client. The difference is very simple. When you are a patient, I must manage you. When you are a client, I am consulting with you, but you are in charge of your problem. As a psychologist in private practice, about 98% of my practice is clients. Okay, I have the habit of calling everybody a patient, but that's not, strictly speaking, true. A patient is someone I must manage. So the difference is this: you come into my office and you're wearing a hat made out of tinfoil, okay? And I say, "Nice hat." And you say, "Yes, I'm going to a Halloween party and the theme is tinfoil, so we're all making tinfoil clothes." And I laugh and you laugh and I say, "So why are you wearing it in my office?" And you say, "Oh, I thought you'd get a kick out of it," and you take it off. And it doesn't really come up again, and it clearly is just some sort of joke thing that you're sharing with me. That's a client. That you are engaged with reality, and you're just here to talk to me about, hey, I need an objective third party opinion on this situation. A patient walks into my office wearing the tinfoil hat with a roll of tinfoil in their hands. I say, wow, nice hat. They say, it is. It's protecting me from the aliens. And they mean it. And they extend the tinfoil to me and say, you need to make one too so the aliens can't read your mind. In a really bad situation, they say, if you don't make one, then I know you are one of the aliens. Now, at this point, everything has changed. This is a person with bizarre delusions. And my job now is to get myself safe first and then to get them safe. Okay? So I am no longer consulting with them. Now I am managing them. That they probably cannot manage themselves, and it's my job to do my best after I am safe to get them to the best safety that I can arrange for them, and to also try to keep everybody in the neighboring area safe from whatever they're doing here. Okay? So a patient is someone I must manage. A client is someone I consult with. If you're watching this video, odds are high you're a client, okay? So, take a deep breath and relax. Even if I call you a patient, you're a client. Why do medical doctors, call everybody patients? Because you're not a medical doctor. You walk in and you say, I've got this pain in my side. They're managing you. You don't know what the pain is, and you're there. You know it's probably okay. Most of the time it's not serious. But you're really there because they can manage you if it is serious. All right. But the really important thing here is that I'm not here to judge you. I'm here to help you. If you are a patient, I'm going to help you. If you are a client, I'm going to consult with you so you can help yourself. And most people are coming in to help themselves. Now, what happens if you don't like me? Actually, I would recommend before you settle into therapy that you try several different therapists. I think it's really important that you like me and that you feel safe talking to me. Now, here's what you need to know. At the time that I was training, we were required to get therapy. And that's a great idea because we needed to know what it's like to be you in our offices, okay? I didn't like a lot of my therapists, and I didn't trust them either. And that's normal, okay? So I don't expect you to come in here and spill your guts. But I do expect you to be sort of testing the waters. Do you feel like you can trust me? And that's okay. It really is. That I'm a total stranger to you. I can't expect you to just walk in here and go, well, you're a psychologist, so I'll tell you everything. That's nice. There are people who can achieve that. But it's okay. But I expect you to take a few sessions to sort of suss me out. I do charge for those sessions. I am making a living here. I have a right to bill for my time. But even so, I would feel better if I was not your first experience. I would feel better if you had met other therapists and you had a sense of what you like and don't like. And if you don't like me, I would feel better if you would leave because I would like you to succeed in therapy. And if you don't feel like you're going to succeed with me, I really want you to go find the person who makes you feel that way. And it's really okay. I know I am not the therapist for everybody. It's really okay. I've got a wait list, guys. It's okay. So no guilt there. The problem with this plan is if you're on insurance, you probably have a limited number of sessions per year. So yeah, you might consider looking in the phone book to see if a private practice therapist gives a free first session. Not many of us do anymore, we used to. And you also may just walk in and say, I would like to pay you in cash for the first session. And I'm fine if you say, what's the lowest fee you will charge me, okay? All of this may vary state by state. My lowest fee in Arkansas is probably going to be different than my lowest fee in California. As you can imagine, cost of living comes into it. Okay, now, I want to point out that psychotherapists are licensed state by state. It's not a national level license. So I can't work with you if you're outside the state of California because I'm only licensed in California. So that means that when you come in for psychotherapy, I may say, hey, listen, if you have a problem meeting with me, we can meet by phone, we can use Skype, we can use FaceTime, we can use a secure channel because some practices have that. If we do that, I'm going to get releases for any kind of video channeling, and that may even be in my intake paperwork, which I'll come back to. But the idea is I can't do it if you're out of state. So if you go on an out-of-state trip and you say, listen, I want to talk to you, but I'll be in Arizona, I can't do that because I'm only licensed to practice in California. So if I'm in California and you're in Arizona, or if I'm in Arizona and you're in California, we're not meeting my license requirements. So if you're out of state, I can't treat you that way. And that's very, very important. If you call me and you're out of state and you're having a crisis, I will refer you to an emergency room, and I cannot advise you. Except for that, I can say, here's how you get help in any state that I know of, and that's go to an ER, okay? If it really is life-threatening, I may say, yes, I'll stay on the phone with you until you get to the ER. I may, in other words, try to be there with you to talk you through it. However, if I do that, I do have to document that I'm doing it, and that may come up as a breach of confidentiality for both of us, okay? So I'm hoping you'll never put me in that position, frankly. But I do have the right in most states to try to stay with you as much as I can through an emergency. That in the act of saving a life usually supersedes the problem in this situation, okay? But you have to really convince me I'm saving a life. It's a very risky thing for both of us. If I'm doing that, I would rather you just walked into a hospital and got face-to-face help. And by the way, I'm looking away because I'm looking at notes if you're wondering. Now, what you need to know mostly, since I'm practicing in California, a lot of what I'm saying now applies to California. So you should feel free to take this video and ask any therapist in your state, if you're out of California, how this applies to them and to you, okay, in your local state. The important thing here, in California at least, is the clinical hour is 45 minutes long. It is not 60 minutes long. That in other words, most insurance providers only pay for me to see you for 45 minutes. Longer than that, I have to really explain crisis stuff, okay? But how do I write my notes if I'm only seeing you for 45 minutes? They do not pay me to write notes, even though I must, ethically, and I'm happy to, really. Okay, but yeah, if you are with an insurance provider, I do have to document what I'm doing with you. Even if you're paying cash, I still will want to do that because I do have the right to record what's going on. That protects both of us. But it's important to realize with an insurance provider, I'm volunteering when I write the note. That time is volunteer. Now, there are ways around it, which you will see sometimes. People will write notes in the session with you there, and they'll go over the note often with you to see, like, does this sound to you like what we did? That's a kind of intelligent and slightly sneaky way to find out if you and the patient are on the same page, which is always a good thing in my book. I don't usually do that. I won't usually write the note while you're there, but that means that I'm volunteering my time to write the note. So please respect the 45-minute hour. Please understand that if you're looking at the clock and you're saying, I'm supposed to have an hour, you do have an hour. 15 minutes of that hour are devoted to me writing a careful and precise note to explain to your insurance provider why they should pay for your treatment, okay? So that's my volunteer time, so please try to respect that and keep it to a 45 to sometimes 50-minute hour.